Hello everyone. Today, we're exploring empagliflozin, commonly known by its brand name, Jardiance. As always, our discussion is intended for educational purposes only. For health-related inquiries or concerns, it's important to consult a healthcare professional. Description: Empagliflozin, marketed under the brand name Jardiance, is an oral tablet categorized as an SGLT2 inhibitor. Its main function is to help the kidneys remove sugar from the bloodstream through urine. Approved by the FDA in 2014, empagliflozin is primarily prescribed for managing type 2 diabetes, alongside diet and exercise. Moreover, it is effective in treating heart failure and has been shown to reduce the risk of cardiovascular death in adults with type 2 diabetes and established cardiovascular disease. Empagliflozin is also utilized in reducing the risk of death from cardiovascular causes, non-fatal myocardial infarction, or non-fatal stroke in adults with type 2 diabetes and cardiovascular disease. Additionally, it is prescribed to lower the risk of cardiovascular death in adults with heart failure and to improve the survival rate of patients with heart failure, particularly those who have difficulty with heart pumping efficiency. Warnings: Empagliflozin is not suitable for individuals with type 1 diabetes due to the increased risk of diabetic ketoacidosis, a condition characterized by elevated ketones in the blood or urine. It's also not recommended for patients with type 2 diabetes who have severe kidney impairment, as its effectiveness may be reduced. Caution is advised for patients with certain genetic kidney diseases or those who have recently undergone immunosuppressive therapy for kidney conditions. Before taking this medicine: Before starting empagliflozin, inform your healthcare provider if you have allergies to the medication. Discuss any kidney-related health issues, as empagliflozin's impact on the kidneys necessitates a thorough assessment of potential risks and benefits. If you are pregnant, planning a pregnancy, or breastfeeding, a consultation with your healthcare provider is crucial. Monitoring of blood sugar levels is recommended for those with diabetes or those at risk for diabetes. Avoid taking empagliflozin if you are undergoing dialysis or have severe kidney disease. It's also unsuitable for individuals with certain genetic forms of polycystic kidney disease or those who are taking or have recently received immunosuppressive treatment for kidney disease. Inform your doctor if you have a history of heart issues, liver problems, bladder cancer, pancreatitis, high potassium levels, or if you are on a low-sodium diet. Additionally, mention if you frequently consume alcohol or have ever experienced diabetic ketoacidosis. Inform your doctor about any planned surgeries or X-ray procedures involving dye injections, as you may need to temporarily stop taking empagliflozin. Side effects: While empagliflozin is beneficial, it may cause side effects such as dehydration symptoms, dizziness, fainting, genital yeast infections in both genders, and a rare, severe bacterial infection known as necrotizing fasciitis of the perineum, Fournier's gangrene. Be vigilant for signs of diabetic ketoacidosis, such as nausea, tiredness, vomiting, trouble breathing, and abdominal pain, and seek immediate medical assistance if these symptoms occur. Other serious side effects include kidney problems, high or low blood sugar, skin or urinary tract infections, low blood pressure, elevated potassium levels, increased cholesterol, and bone fractures. Dehydration risks are heightened if you don't consume adequate fluids, experience vomiting, or have diarrhea. Symptoms of dehydration include dry mouth, thirst, reduced urination, dark urine, dry skin, and dizziness, especially when standing up. Always consult your healthcare provider for advice on side effects and report any new or unusual symptoms. Interactions: Empagliflozin may interact with other medications, so it's essential to inform your doctor about all medications, supplements, and herbal products you are taking. Dosage: Adhering to the prescribed dosage is crucial for the medication's effectiveness. The typical dose of empagliflozin for adults with type 2 diabetes is 10 mg once daily, taken in the morning, with or without food. Depending on your response to the medication and your doctor's advice, the dose may increase to 25 mg once daily. For treating heart failure, the recommended dose is also 10 mg once daily. Empagliflozin is not recommended for patients with severe renal impairment, end-stage renal disease, or those on dialysis. Always consult your healthcare provider before making any changes to your dosage. Avoid: To prevent dehydration while taking empagliflozin, stay hydrated. Be cautious when rising from sitting or lying positions to avoid dizziness. It's also advisable to limit alcohol consumption, as it can exacerbate certain side effects. FAQ. Concerns often arise about age restrictions for empagliflozin. Its safety and efficacy in individuals younger than 18 have not been fully established. For specific questions related to this medication, consulting a healthcare provider is recommended. Closing. This concludes our overview of empagliflozin. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult a healthcare provider for any questions or concerns. Thank you for tuning in.